Hello, Alex Sanchez?
Yes.
Hello, Alex Sanchez. My name is Esmeralda, and I am a medical assistant. I'm going to do the patient history report with you today. Do you have a few minutes to answer a few questions?
Yes, thank you.
All right, excuse me. I'm going to take a seat right here. And then, Alex Sanchez, what is your preferred name?
I like Alex works.
Okay. All right, thank you, Alex. And Alex, what are your pronouns?
She, her.
She, her. And to confirm, your date of birth is January 22nd, 1990.
Yes.
Okay, and your occupation is engineer?
Yes.
When was your last doctor's visit?
Like 1 year ago.
1 year ago. Okay, so that would be approximately February of 2023?
Yes.
Okay. And what are you here for today?
So I've had a sore throat, watery eyes, just a little bit of irritation that I can't get rid of.
And when you say irritation, where is the irritation?
Mostly in my throat area and a little bit in my mouth.
And throat and mouth. And then when did the sore throat start?
I would say 1 week ago.
1 week. And what about the watery eyes?
About the same time.
Same time?
Yeah.
And what about the irritation in your throat and your mouth?
I would say maybe just a few days after, so 5 days ago.
5 days ago, okay. And have you traveled recently?
Yes, I recently, 2 weeks ago, I came back from a trip that I went to Belize for about 1 week.
Belize for about 1 week, okay. So you were there for 1 week, and then how long ago did you say you went on that vacation?
I went there 2 weeks ago.
2 weeks ago, okay. So 2 weeks ago. And no travel other than that Belize trip?
No, just there and back.
Okay, sounds good. So I'm going to ask you about your past diagnoses. In the past, have your doctors diagnosed you?
Just with anxiety.
Anxiety, okay. And then when was this diagnosed?
I think 2020, during the pandemic.
2020, okay. And do you have any past surgeries or hospitalizations?
I had a surgery in my tonsils. I think I was 12, so in maybe 2002 or so.
2002.
I would have to double check.
And were there any other surgeries?
No, just.
Okay. Are you currently on any medications?
Yes, I am on Lexapro.
Lexapro. Can you spell that for me, please?
Yeah, sure. Lexapro.
And what is the Lexapro for?
It's for anxiety.
For anxiety, okay. Right. Do you remember what immunizations you've had in the past?
Yes, I've had tetanus, hepatitis, for the flu. I had my MMR vaccine, and I also got vaccines for the trip to Belize. I got a vaccine for yellow fever.
Okay.
And for pertussis, for the whooping cough.
Okay. And then do you have your COVID vaccination?
Yes.
Okay. Do you remember if you have immunization for pneumonia or chickenpox, varicella?
I don't think I got the chickenpox vaccine.
Okay.
And yeah.
If you can ask your past medical clinic to send us the information, that'd be wonderful. We'll ask you to sign a consent form before you leave.
Okay.
And do you have any allergies?
Just to pollen.
To pollen, okay. Is there anything else?
No.
And what is your reaction when you interact or encounter pollen?
Just similar, sore, watery eyes. I get really congested. I can't stop. It's hard to breathe.
Okay. Do you take anything for it?
No. Usually it just goes away with some time.
Okay. So no medications for the pollen allergy. Okay. I'm going to ask you about your health habits and personal safety. In 1 week, how often do you exercise?
I would say I exercise probably 3 times a week or so. I like to play basketball with friends.
Okay, so it sounds like basketball. And then what is your caffeine intake?
I drink coffee basically every day.
Every day. Okay. And alcohol?
Not too frequent. Maybe twice a week.
Twice a week. Okay. And what about tobacco?
No
No
tobacco.
tobacco use. And drugs?
None.
Okay. Who do you currently live with?
I live alone.
Alone. Okay. And do you feel safe in your living condition?
For the most, I say I feel safe. The only thing is that I feel like so when I came back from my trip from Belize, I noticed that a factory that was being built opened, and ever since then, it just feels like the air is very polluted. It's hard to breathe when I go outside, and it just feels really dirty.
Okay. And this, to repeat, so this happens about 2 weeks ago when you returned back from your trip from Belize.
Yes.
And you notice the factory is producing that really strong polluted air.
Yes.
Okay. And it's hard to breathe.
Yes.
Is there anything that helps you feel better?
Usually I just try to stay in my house, just to try to stay away from the pollution.
Okay, so you stay inside the house. Okay. And I just have 2 more things to ask it for you. For the family health and personal safety, do you have any family members who have past health concerns?
Well, I know my aunt, my mom's sister, had skin cancer, but she was okay. She survived the treatment.
Okay. And how old was she when she was diagnosed with skin cancer?
I think like 58 or so.
58. Okay. Are there any other family members who had health concerns?
My mom's father, my grandfather, passed away when he was 80. He got a heart attack.
And that was, you said, 80 years old?
80 years old.
Okay. By a heart attack. Any other concerns you would like to share today?
No, I think that's basically it.
Okay, and the last section is the mental health section. In 1 week, do you feel anxious?
I would say about pretty often, like five times a day, basically every day I go to work.
Okay, and what about feeling depressed?
No, not really. I would say not.
Okay, do you have trouble sleeping?
Sometimes I would say, especially ever since the factory opened up, I would say I'd have almost three times, at least 3 times a week, I'm having trouble falling asleep.
Do you have trouble eating?
Ever since I got sick, yes, I would say I don't eat enough. So maybe, probably 3 or 4 days a week I have a hard time. I have a hard time getting enough food.
And so these are all the questions I'm going to ask you today. Is there any other information that you want to share with me regarding your health that I did not ask you about?
No, I think that's good. Thank you.
Well, thank you so much. So these questions I'm going to forward to your nurse and your doctor, your medical team, to review. And before that, I am going to do the vitals with you, just to give them a more comprehensive information about your health. Would that be okay?
Great.
All right. So just to recap and give you, just make sure I have all the information here. So Alex, it looks like you went to Belize about a week ago, for a week, and you went about 2 weeks ago. And since then, you've had sore throat, watery eyes, and irritation in your throat and in your mouth. Is that correct? Okay. And then just to make sure, you are updated on your immunizations, and then we're going to have you sign a consent form to send the rest of your medical records over. You're currently on Lexapro for the anxiety that was diagnosed in 2020. You had surgery for tonsils when you're about 12 years old. That's correct? Let me just make sure. So you shared with me that there is a factory that opened about 2 weeks ago when you returned back from your trip from Belize, and you've noticed that the air quality has significantly gotten worse,
Yes.
that there's a lot of air pollution. And so a way to be safe is that you've been staying inside of the house to stay away from the pollution. Is that correct? Okay. And to make sure that I have all your family health records, your aunt on your mother's side has skin cancer, about 58 years old, and your grandfather, also from your mom's side, had a heart attack at 80 years old.
Yes.
Okay. And the rest of the information I'm going to review with the doctor. The doctor and the nurse, when they come in to talk to you after we get the vital signs done, they might have a little bit more information to ask of you, if that's all right.
Okay.
All right. Thank you so much for coming in, Alex. I'll be right back with you to take your vital signs, okay?
Thank you, Esmeralda.
Thank you, Esmeralda.